Hello, my name is Dr.Fraum, and I'm an assistant professor of radiology with appointments in abdominal imaging and nuclear medicine at Washington University School of Medicine in St. Louis, Missouri. I specialize in oncologic imaging with a focus on MRI and PET studies. Today, I'll be addressing the question of how large a cancer spot needs to be in order for it to be seen on a scan, and I'll be covering different imaging modalities such as MRI, CT, and PET. So these imaging studies produce pictures of cancer spots in the body in very different ways. Additionally, different types of cancers can be easier or harder to see depending on the type of imaging study used and the locations to which the cancer is spread. As such, it's impossible to give one particular size of cancer spot that would be visible on a particular modality across all cancer types and disease locations. To help you understand what I mean, I'll provide some examples for MRI, CT, and PET scans. MRI, or magnetic resonance imaging, is a radiology study that helps, I'll start over there. MRI, or magnetic resonance imaging, is a radiology study that makes images of the body by taking advantage of the magnetic properties of human tissues. MRI, particularly when performed with the aid of contrast material, is very good at identifying cancer spots in solid organs and soft tissues. A properly performed MRI has the potential to detect cancer spots in the liver or brain when they are only 2 to 3 millimeters in size, or about 1/10 of an inch. However, MRI isn't as good at finding cancer in the lungs, which consists mostly of air. An MRI might not be able to detect cancer in the lungs until it has reached almost 1 centimeter, or just under 1/2 an inch in size. For this reason, we don't typically perform MRI scans to look for cancer spread to the lungs. CT, or computed tomography, is a radiology study that makes images of the body by releasing radiation and measuring how much of that radiation passes through the body to be detected on the other side. CT scans, even when performed with contrast material, are generally not as good at finding cancer in the liver or brain as an MRI. Cancer spots as big as 1/2 an inch in the liver or even a full inch in the brain can potentially be missed or incompletely characterized with a CT scan. However, it's important to note that in many circumstances, CT is a very good, reasonable option. Let me start over there. However, it's important to note that in many circumstances, CT is a very reasonable option to look for cancer spread in the chest, abdomen, and pelvis, with the addition of an MRI for assessment of the solid organs such as the liver if needed. CT also does a much better job than MRI at finding early cancer spread to the lungs. Even when performed without contrast material, a CT scan of the chest can identify nodules in the lungs as small as 1 to 2 millimeters, or less than 1/10 of an inch. PET, or positron emission tomography, is a radiology study that involves injecting a radioactive molecule called a tracer into the veins and then taking pictures of the radiation emitted by the tracer after it has had some time to distribute throughout your body. PET scans are almost always paired with a CT scan, which helps the radiologist interpret the findings on a PET scan. The ability to see a cancer spot on a PET scan depends on how much of the tracer the cancer spot accumulates. Different tracers are used to detect different types of cancers. But one of the most commonly used tracers is called FDG, which is a radioactive form of glucose, the primary source of sugar used throughout the body. For a PET scan using FDG, it's harder to find cancer spots in organs like the liver and the brain that normally take up a lot of sugar. Additionally, some cancers, like most lymphomas and melanomas, take up a lot of FDG, whereas other cancers, such as pancreatic cancers, may not take up as much. As a result, a PET scan may be able to identify a melanoma lesion of 2 to 3 millimeters, or about 1/10 of an inch, but might not be able to identify a pancreatic cancer lesion until it is perhaps 5 to 10 millimeters, or about 1/4 to 1/2 of an inch in size. So to summarize, the ability of an imaging study to detect a cancer spot depends on the type of imaging study, the organ in which the cancer spot is located, and in the case of a PET scan, how well that cancer takes up the tracer that has been administered. In general, our imaging studies are unlikely to identify cancer spots smaller than 2 to 3 millimeters, or about 1/10 of an inch in size, but are quite likely to identify most cancer spots that are at least 10 millimeters, or about 1/2 an inch in size.